Hello and welcome to the Sexy Talk. Today we're going to be talking about safe sex, and I'm not talking about knocking over candles and setting the house on fire. When I say safe, I mean protecting ourselves from unwanted pregnancy and sexually transmitted diseases. So at the end of this video, you'll know what that creepy adult meant when they said,
"As long as you're being safe, kid." So now the trickiest part about birth control in general is that there's not one right answer.
No, there's gotta be one.
But there isn't one.
No, there's gotta be a best birth control.
No, there's no perfect form of birth control. You're gonna definitely try out many different methods as you get older and throughout your life to figure out what works best for you. And there's a lot of different options, which means we have a lot to cover. And we're gonna start with our trusty old friend who gets rolled onto way too many bananas in way too many sex ed classes: condoms.
Hi, I am Dr. Megan Cox-Pedota, and I'm a board-certified obstetrician and gynecologist. A condom is basically like a sheath, like a little tube that goes over the penis. Most commonly, there are female condoms that can go inside the vagina as well, but the more commonly used ones are the like sheath or wrapper that goes over the penis. And they're commonly made of latex, or if you have a latex allergy, there are ones made from sheepskin. It is a barrier method or a blocking method because it holds the semen and the sperm inside that sheath or covering so it does not enter the vagina. Still, pregnancy rate with condoms can be anywhere from 10 to 15% depending on use. But condoms are very effective at decreasing the incidence of sexually transmitted infections. Even if a partner tries to convince you that you should not be using a condom, take care of your own body, protect yourself, and insist upon always using a condom unless you are with a trusted partner that you've been with for a long time. For a female, your reversible options would be the birth control pills, the vaginal ring, the Depo shot, which is a shot you get once every 3 months, a patch that you wear for 3 weeks at a time, the arm implant, the brand name for that right now is called the Nexplanon, or the intrauterine devices. For irreversible for women, the only option we have is a tubal ligation, which we remove the fallopian tube surgically. For men, unfortunately at the moment, the only reversible option they have is condoms, but hopefully that will be changing in the near future as more research is done. Men do have the irreversible option of a vasectomy.
How did your birth control adventure begin?
So I actually started having sex around 16. But I wasn't on a formal form of birth control until I was 18. And the main reason was because sex wasn't really openly talked about in my household. So I wasn't really comfortable going to my mom and saying, like, I need to go to the doctor for this purpose. And so up until that point, I was only using condoms. And when I turned 18, I knew that was the first thing I wanted to do. Was I wanted to make a doctor's appointment and get on birth control as soon as possible. The first thing I did was get onto oral contraceptives, so birth controls in the little pill pack. So that's how I got started. I just very urgently at the age of 18 was like, now my medical records are only mine, and now I'm going to go to the doctors and get my birth control that I need.
There's lots of different combinations, but there's really two different forms. There are pills that contain both estrogen and progesterone, which is the most common pill. And then there is a type of pill that is progesterone only. So the combined pill you take every day, and at the end of that pack, for most packs, some don't have this, there's fake sugar pills, and during that time you get a period. And so when you're on the pill, you don't ovulate, because keeping those hormones at a steady level all month long stops ovulation from happening. But this is okay, because as soon as you come off of the pill, within about 1 to 3 months, women go back to ovulating on their own. And that's how that mainly prevents pregnancy. The progesterone only pill does not always stop ovulation. It mainly works by thickening cervical mucus, so the kind of discharge that sits on the cervix, and that blocks sperm from getting into the uterus. It also makes the lining of the uterus really, really thin as a way to prevent pregnancy. And so it's just not quite as effective as the combined pills because it doesn't stop ovulation all the time. So the NuvaRing is very similar to the birth control pills that contain both estrogen and progesterone. It just gets absorbed in a different way. You put this ring that's made of a polymer, so it's a very flexible, soft ring, inside the vagina, and very slowly the hormone gets absorbed through the vaginal lining instead of through the stomach. And so it still has that constant estrogen and progesterone all month long that is preventing ovulation. The patch is kind of what it sounds like. It's a patch that you place on your skin anywhere you want, on your belly, on your thigh, and the estrogen and progesterone get absorbed through your skin with the patch. So it acts similarly to the birth control pills because it's both estrogen and progesterone, so it stops ovulation. So the shot is an injection of progesterone only, so no estrogen with this one, that a patient would get every 3 months. So they give you a date that you're due to come back, or a window that you're due to come back to get your next injection. Because it's a high dose injection of progesterone, it does commonly stop ovulation, and it also thickens the cervical mucus and thins the lining of the uterus to prevent pregnancy. So the intrauterine devices, there are a few different kinds, but they're part of a class of birth controls called the long-acting reversible contraceptives. These are the contraceptive options that a provider places for you, and they can last for a long time, and so then tend to be a little bit more effective for pregnancy prevention because there's not as much user error. The hormonal intrauterine devices, the ones with progesterone in them, prevent pregnancy by, for one, being in the way. Commonly, the sperm don't make it to the egg because the intrauterine device blocks the sperm from getting where it would need to go to implant inside the egg. It also keeps the lining of the uterus really, really thin so that there's no area for an embryo to implant. It thickens the cervical mucus, again, that discharge that sits kind of on and in the cervix. And that alone blocks sperm from even getting into the uterus through the cervix. There's also a copper-only intrauterine device, so it has no hormones in it at all. Its main function for preventing pregnancy is because sperm can't really survive in the presence of that copper. And so the sperm, typically once they make it into the uterus, completely die off and they don't make it to the egg. But then also, like the hormonal IUDs, it sits in the way. The arm implant, or again, the brand name that's out there right now is the Nexplanon, is a bar about that long that goes underneath the skin of the arm, usually in your non-dominant arm, so you don't feel it. You can feel it when you push on it, but in your day-to-day activities, most patients don't notice it, they can't feel it. And so it can sit in for up to 3 years, preventing pregnancy. Its main way, because it's a progesterone only, it has no estrogen, is that thickening of the cervical mucus again, the keeping the lining of the uterus really, really thin. And some women don't ovulate on the Nexplanon.
You don't have to be sexually active.
You don't have to be having sex or planning to have sex in order to be on birth control.
I wasn't sexually active for like, I think 2 years after I started taking the pill.
There are also other purposes for birth control besides pregnancy prevention. We title all these hormones birth control, which I think throws a lot of people off when they come to me and we're going to use these hormones for other purposes.
I had friends who did. They went on it for acne, or they had really heavy periods, so they would use it. I had and have depression, and it got worse around my period. And I was talking to my doctor about it, and she said, if it's happening around your period, then maybe the pill is going to be right for you because it gives you hormones to kind of keep it steady instead of going up and down, which did help for a little while.
When I'm thinking about birth control, I need to make sure it fits my lifestyle.
Definitely having a conversation with your physician about your different healthcare issues, your concerns about your body will kind of guide which birth control option is best for you. Certain health issues mean that you cannot use birth controls with estrogen. For instance, if you have migraines with an aura, commonly that is a contraindication. That is a reason to not use birth controls containing estrogens. And there's lots of other health issues like that could guide which birth control to use. Also, how your periods are. If your periods are painful or are really heavy, there are certain birth control options that will work to help prevent pregnancy, but will also work really well to make your periods less painful or less heavy.
We've learned a lot in this video, but to figure out what birth control option works best for you, please contact your primary care provider. And just remember that if you don't like the first option that you're given, you're always welcome to go back to that provider and discuss other options. And you don't have to be having sex or planning to have sex in order to be on birth control.
Yeah, and if you feel comfortable, talk to your friends and your family about their experiences with birth control. Just remember that they don't have your body, so your experience with it may be a little different from theirs. And just a reminder, the only method that we talked about today that protects you from STDs are condoms or other barrier methods.
And we'll be talking about STDs in other videos, but in the meantime, stay safe and stay sexy.
Yay!